It was supposed to be a magical time. I should be glowing. Doesn't every pregnant woman glow? What is wrong with me? I can't think straight. All I do is worry. I can't get out of bed. I call off work most days. My house is a mess, and I don't even care. Everyone keeps asking me about the nursery, what I'm going to name him. Am I excited? I just can't answer another question. I don't feel anything anymore. I'm done. These are often the voices of perinatal mood disorders. Hi, my name is Jen Younker, and I am the director of Bester Community of Hope. I'm also a licensed clinical social worker. I'm a mom, and I'm also someone with lived experience with perinatal anxiety and depression. So, thanks to a lot of education, research, supportive opportunities, many people are familiar with the term postpartum depression. But what many people don't know is that a woman may experience a mental health crisis during any stage of pregnancy, so from conception, as well as to 1 year following the birth of her child. This time period is commonly referred to as the perinatal stage. So we know that sudden fluctuations of hormones, as well as the sheer impact of growing a tiny human, can drastically alter the physical and mental state of a woman. Just as pregnant women can develop high blood pressure or a variety of other medical conditions, she can also develop depression and anxiety. Additionally, pregnancy can also exacerbate previous existing conditions as well, meaning a woman who may have experienced depression in the past may experience an increase in depressive symptoms or a return of depressive symptoms. And all of this is regardless of race, income, age, ethnicity, or education. Another thing that many people do not know is just how common it is for a pregnant woman to experience a mental health crisis during the perinatal phase. So approximately 1 out of every 7 women experience significant depression, anxiety, intrusive or repetitive thoughts, panic, or a post-traumatic stress response during pregnancy. In fact, pregnant and postpartum women are more likely to develop depression and anxiety during this time than any other time in their life. So bottom line, it is very common. Developing a perinatal mood or anxiety disorder is not your fault, and you did not do anything to get this. So what does this look like? So there are lots of symptoms that can occur during this time, and many of those may look like someone who is restless, agitated, feelings of guilt and worthlessness, feeling empty or numb, finding no pleasure in things that they used to enjoy, feeling very hopeless, maybe despairing. Sometimes you will observe or feel hostile or simply indifferent to your partner, your baby, your coworkers, your family, suicidal feelings, panic attacks, a sense of dread or fearing for the worst, feeling like the world is speeding up or just slowing down, feeling like other people can just see how anxious you are and they're looking at you, feeling like you can't stop worrying or worrying about the anxiety itself, wanting lots of reassurance from other people or worrying about other people getting upset or worried with you that you're losing touch with reality. And some women may experience intrusive thoughts and images, sometimes delusions. So those are thoughts that are not based in reality or even hallucinations. And that's hearing and seeing things that aren't there, and sometimes some disorganized thinking. It's not an exhaustive list, but it can give you an idea of what things to look for. So how do I know that this is something I should be worried about? How do I know that this is not just the baby blues that everyone talks about? So typically baby blues only occur following the delivery of the baby, and it is very short term. So you're looking at a few days to a couple of weeks max. A mental health disorder is going to last longer than 2 weeks, and it's going to greatly impact your daily living. So now here's a little good news. It's completely treatable. So if you, your partner, a loved one is experiencing a mental health crisis, connecting with a professional is critical. Your OBGYN, your another physician, a therapist are all good places to start. There are safe and effective treatments. These things can consist of therapy, relaxation techniques, group counseling, medication. You, your therapist, your OBGYN can all work together to develop a plan of action that is best for your individual needs and the welfare of your baby. So what are some other things that you can do to address your mental health? First and foremost, be patient and kind with yourself. Confide in someone that you trust. Make sure you have that person that you can call on during those truly darkest moments, and someone that you can just kind of voice all the things that you are experiencing without judgment. Journaling, keeping some detailed records of kind of some of the thinking that you're having or thoughts that you're having or ways that you're feeling can really help not only you address a lot of those feelings, but also can help a therapist who you're working with identify maybe what are some of those thinking patterns, or I'd be able to, much more clearly identify what some of your struggles might be. Get to know your triggers. Are there things that make it all worse? A smell, a sound, a place, a person. Try peer support. That can be incredibly powerful to have conversations with other moms who may have experienced some of the same things that you're experiencing. Breathing exercises, relaxation techniques can also be powerful. Many of those you can access online, download to your phone, listen to in the convenience of your home or car. Shifting your focus. So things can feel extremely overwhelming and we can constantly worry about things over and over and over again. So shifting your focus to something small, something that you can easily address, that's not overwhelming to you. And very, very importantly, creating safety through a good support network. So what can you do for a partner or a loved one who's experiencing a perinatal mood condition? First and foremost, listen without judgment. Never blame or belittle. Offer support. Don't be surprised if they have absolutely no idea how you can even be supportive. Offer to just spend some casual time with them. Make some time to just keep in touch. Learn about perinatal mood disorders and perinatal mental health. Offer some practical support. That might look something like helping with some house cleaning, childcare, tasks that may seem very overwhelming to that other person. That's pretty simple for you. Support them to get help. Offer to arrange a doctor's appointment, offer to go to an appointment, offer to help them research services or opportunities for them. But lastly, I also want to talk about fathers and partners of women in the perinatal stage. This can be a lot to consider and possibly feel like a very overwhelming responsibility, but you two are not alone. Additionally, there is research that shows the impact of your mental health during this time as well. So while you may not be pregnant, you too have an elevated risk of a mental health concern during the woman's perinatal stage. So 1 in 10 dads will get perinatal depression, and it's actually more like 50% if the woman is also experiencing perinatal depression. So if a pregnant woman is experiencing perinatal depression, there's a 50% chance that you as the dad, the partner, the very close supporter, caregiver, could experience some depression symptoms as well. And those symptoms are going to look very similar to those that I shared previously about the symptoms that a woman might experience. So therefore, it is equally important for partners and pregnant women alike to practice routine self-care, understanding your own mental health, and certainly seeking help when times are tough. So if you know someone who is struggling with perinatal mental health, please know that there is hope. You're not alone. This doesn't make you a bad person or equally a bad parent. It does not last forever. And there are resources to truly help you in overcoming the darkest of days. Start with connecting with a therapist or having the conversation with your doctor.